Hello, I made this video to talk about GLP-1s and basically their impact and how we go about getting them and some more information just as an overview. You and I can go over all of this in greater detail at your visit. So the first thing I want to discuss is that these medications were initially developed as diabetes meds. So they're used to bring blood sugars down as well as decrease appetite. The ones that are approved for diabetes right now are the Ozempic and the Mounjaro. And the ones approved for weight loss are the Wegovy and the Zepbound. Similar medications, just different approvals through insurance. These medications work by slowing gastric motility through the GI tract, through the stomach and intestine. So what happens is you feel fuller for longer, so you don't feel as hungry, so you eat smaller portions and feel full, or you don't eat as much throughout the day, resulting in a caloric deficit, as well as the medicines will help to decrease blood sugars. Because of the way the medicine works, the most common side effects we see are related to the GI tract. So we see nausea, we see upset stomach, we see constipation or acid reflux. Some patients will take nausea medicine, most commonly the day after an injection. This medicine is dosed once a week, so you would basically do an injection on Monday and then again the following Monday. With these medications, we usually titrate the medicine up. So what that means is you would start with one dose for 1 month, once a week, and then after that we would increase the medication dosing for the following month, all the way up to a dose that would lead to target weight, or if you were unable to tolerate it because of side effects. We now understand that obesity is treated as a lifelong condition, similar to diabetes or high blood pressure. So likely you will be on this medication lifelong, although we will likely decrease the dose back down once you reach your target weight. And at that point, we would do what's called microdosing, where you would take a dose instead of weekly, maybe every 2 weeks or once a month. And that's something you and I can discuss in greater detail at future visits. Important things for this medication to consider is, number one, because you're losing weight, we don't want you to lose your muscle mass. So very important to make sure you're eating enough protein in your diet. That would include trying to eat at least 1 milligram per kilogram, and we can go over that in detail at your appointment, of protein. Ways to get protein include meats, ideally lean meats, so turkey, fish, cheese or dairy, Greek yogurt, and protein supplements, right? Like a protein shake or protein smoothie, protein bar, those kinds of things. We also would want you to increase your strength training for building muscle to maintain that muscle mass. So that way you don't lose muscle, become weak, and have more problems as a result. So we'd have you be doing some type of weight bearing type exercise. So it could be something as easy as, walking and using very light weights, doing bicep curls or body weight exercise, and we can go over that in detail. Regarding these medications, the most difficult part of getting access to them is usually the insurance coverage. Every insurance is different, so there's really no way to project or predict how you would go about getting the medicine. We usually submit it to the pharmacy, and then the insurance company will have us submit what's called a prior authorization, and hopefully will cover the medicine. A lot of times they don't cover the meds, and as a result, we basically can prescribe it, but it's very expensive, usually about $1,200 per month out of pocket. So some people do use what's called a compounding pharmacy, where it's an independent pharmacy that will go ahead and make the medication to their specifications and then mail it to you directly. This is not FDA covered, so it's not as guaranteed of a product. We don't have really any way of knowing exactly what's in there, but it's at least a good alternative to those who don't have the insurance coverage available. These are often prescribed by physicians through each independent compounding pharmacy's website, and we can go over those in detail as well. This is just kind of a very basic overview. If you have any other questions, we can go over it in detail at your appointment, but at least this is a good starting point for us to start our conversation. Thank you.